Some people think hepatitis B had negative on their life, but for me, actually it's quite positive.
Xin chào, I'm Tô Nguyên. I originally came from Vietnam. I've been in Australia since 2022.
I live with my wife and one son, 11 years old.
My name is Dr. Amira Fakuri and I'm a general practitioner here at Utopia Refugee and Asylum Seeker Health. 31% of the Australian population with hepatitis B is currently undiagnosed. The first point of contact to the healthcare system is through general practice, so it's really important as a GP we detect and screen for hepatitis B.
I found out I had hepatitis B in a routine health checkup in 2010 when I was in Vietnam. That came as a surprise, and I wasn't experiencing any noticeable symptoms at the time. I had a mixed emotion. I worry it might have some effect to my health and my lifestyle. So far, my experience with the healthcare system is quite positive. The medical professional is very helpful and gave me a lot of useful information about monitoring and treatment. A routine health checkup initially is quite challenging, but it becomes normal in my daily life.
At Utopia, we generally have a practice approach to managing hepatitis B patients. The patient will have multiple interactions with the GP and the nurse and the practice manager. We also have all our doctors that are S100 prescribers, so if the patient is detected to have hepatitis B, we therefore can treat them.
Before, I very less active person, but since I know about hepatitis B, I be more active, and nowadays I'm a triathlon athlete. It really helped me to motivate and enjoy life.
One of the most common barriers for hepatitis B screening is the GP actually remembering to do the screening in the blood tests. One of the other barriers is when a general practitioner doesn't identify the patient as being high risk of hepatitis B. It's actually a good idea for GPs to have that incorporated in their autofills on best practice, for example, where hepatitis B is a box that needs to be ticked. As a GP, you should feel very supported in managing hepatitis B. There are many resources available, such as the PHN and the ASHM website. In general practice, it's very easy to screen patients for hepatitis B. It's a very quick test that we can refer patients to, and that ultimately will mean that early detection will have a better prognosis for the patients.
I think the GP should prioritize the screening because that is really crucial on the early detection. By doing that, the GP can prevent the spread of the virus, and also they can give the better assurance about the health of their patient.